Dr. Scott Threde at Active Life Chiropractic, and I'm sitting here with Jody Knight, who we treated during her pregnancy, and we're going to talk a little bit about the symptoms that she came in with and her experience through the process of getting adjusted and how that helped her in her pregnancy. What were the symptoms that you initiated care with?
I had low back pain.
Lower back pain, okay.
Yeah.
So how did you start your pregnancy, though, previous to meeting me? There was other complications?
Yeah, I was on bed rest around 10 weeks, and then after being on bed rest for a while, I started getting low back pain, and that's when I came to you around 18 weeks.
Okay, all right. So, and you came in and we started treating you. I think we're treating you a couple times a week originally, right,
yes,
through the pregnancy.
Yes.
And this is in the second trimester. And as we went, did the lower back pain lessen?
Yes, definitely.
Okay, all right. Were there any other physical benefits that you found of being adjusted during that time frame? You know, did you feel any more ease? Did you feel more comfortable?
I was just a lot more comultable.
Okay.
I was able to go back to work after they released me.
Good. So, and you'll see in the other part of this video too that Jody's, the ultimate, at the end of this rainbow was the fact that Jody had a 3.5-hour labor time, and now she's got this 1-month-old baby boy, this beautiful baby boy that's completely healthy. So 3.5-hour labor, that's pretty good, huh?
Yeah, it was really fast.
The other thing to note is that Jody is a labor and delivery nurse, so she's around this all the time, every day, essentially at work, so she knows a lot about it. And so you also had a previous child, and how long was your first labor?
My first labor was about 12 hours.
12 hours.
But I needed Pitocin to keep things going, and it took a long time for labor to get started. My water broke. It took about 6 hours from the time my water broke till labor started, so this was way faster.
Yeah, so a lot of work, a lot more effort.
Yeah.
Probably a lot more stress on the baby itself, right?
Possibly, yeah.
Yeah, I mean, I don't know. I'm not an obstetrician, but I would think that if it's an easier delivery, it's easier for both parties, right?
Yeah, yeah, he did good.
Okay, so, and it's true, though, that I think that women can expect that their second delivery is going to be shorter.
Yeah,
that's
usually
pretty
it's a little bit faster, but not as fast as this.
Yeah. So there's a dramatic difference in the first time you weren't under chiropractic care, right?
Right.
Okay, that's cool. And so can you see a correlation between the adjustments and the shortened delivery? Do you feel like?
I just feel like my body was really working well and everything was where it needed to be. And
okay, that's great. So would you recommend other women to get adjusted during their pregnancy?
Definitely.
Awesome. Okay, good. So if you have questions about pregnancy and chiropractic, you're within our website. We have a whole heading for pregnancy and chiropractic, and you can have an experience, hopefully, like Jody had with a 3.5-hour labor and a beautiful baby that can sit here actually and sleep through this whole video recording, which is great. Okay, so take a look around the website and look for other things that can help you benefit from our care.